Debbie, and thank you for the inviting me back again for the second session. Long-term care is such a big issue, and for those of you that were at the first session, thank you for tuning in for the second session. So anyway, really briefly, for people that don't know the magazine, Generations Magazine is a resource magazine, and it was created. What was that? About 2007 by a gentleman by the name of Kini Popo. He was a visionary and really started a magazine before I did. I was his consultant. I got paid to consult him on topics and issues going on around town. Unfortunately, he passed away a couple of months back, just recently. I took over the magazine in 2010, and the rest is history. It's amazing how, I had a vision of this many years ago, and it was just something that I thought about aging when I got into my day job, the reverse mortgage, 20 years ago. The magazine was started in 2010. It is today going on 13, 14 years. We've created workshops, webinars, radio shows every Sunday morning, podcasts on our website. So it's been a very enjoyable time for us to really understand aging. So I just want to make sure, Debbie, you can see this little cartoon here. So this is a cartoon I found many years ago that I always try to get people to understand aging is, and for men it's a little bit different than women. Your husband is suffering from a very severe stress disorder. If you don't do the following, he will surely die. Each morning, fix him a healthy breakfast. Be pleasant at all times. For lunch, make him a nutritious meal. For dinner, prepare an especially nice meal and no chores, no nagging. Oh yes, make love several times a week. Do this for the next year, and he will regain health because he's going for his annual physical, as you can tell. Doctor's talking to the wife. So the guy goes outside and asks the wife, what did the doctor say? Said you're gonna die. It's the dynamics of aging for couples is very unique, and it happens quite a bit, and it's something that I think we all need to understand as we age. So anyway, let me just pull up so the first session that we did, we covered a lot of topics, generic topics, so I wanted to do a real brief overcap in the next, 5-10 minutes. I saw this comment many years ago. There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need care themselves. And Rosalind Carter made this famous quote, gosh, I think 15 to 18 years ago. So, I've been doing this 20 years. When I got in the reverse mortgage business, I wanted to understand my clients. So I did a deep dive, did a radio show back in 2005, 6. I did about 70 different topics on Olelo in 2004. Just interviewing different people, experts in their field. And that's how I gained my knowledge over time. So I'm kind of a self-trained person. But what I found many years ago was a tsunami of long-term care coming. And our baby boomers here, I'm 62 now, baby boomers, parents going to need care. And that's the biggest demographic we see right now. Every day somebody calls me from my family, friends, people I socialize with. I was at a dinner party Friday night. A couple of people came up to me and said, yeah, I'm dealing with my parent. What do I do? And it's something that you have to really be your own parent's advocate or your own self-advocate on navigating aging and navigating long-term care. It is a very difficult challenge. You need to seek out professional help. And it's really important to talk to the families early. We're all going to have health issues down the road at some point. Hopefully not, but most of us will. And it's something that we have to be proactive about versus reactive. And it's something that I think, when I started this business 20 years ago, it was about a 50-50 chance you're going to need some form of long-term care. And 2012, I believe it was, where it came out a new study by ARP that says 79% of the women are going to need some form of long-term care. And men is 69% going to need some form of long-term care. That's over 10 years ago. And that's a national statistic. I think going forward, you're going to see that rise in Hawaii because we live longer than than any other state, and care and hospice is going to be needed by all of us. But long-term care is really about, like I was telling my dad, he was a caregiver for my mom, and he didn't really realize that. So it is something to think about as you get older, whether you're married or not, who's going to care for you, how you're going to pay for care, and will the family help you pay for care? So that's kind of the premise of everything that we do, is all these little questions. Family is great. Unfortunately, I was talking to my friend this morning. He's living with the mom, taking care of mom. Mom's actually pretty healthy, but he's starting to have health issues. He's been caring for mom for over 10 years. He's having issues now himself. And he was trying to work and care for mom at the same time. So it's just something to think about down the road. Debbie, I don't know if you want to send this thing out again to the participants this time, but this is just a basic PowerPoint that was created by actually Todd Pang, who owns 2 care homes and facilities in Manoa, and we'll bring his website up a little bit later on because he's very involved in long-term care. It's a 24/7 job, and it's not something that I recommend people do. If you can afford it, pay for care. And it's really important to understand talking to families, because we see a lot of in-family fighting now. I've seen legal battles for neighbors and family friends of mine, fighting over money, fighting over quality of care. I've seen a family recently got rid of, sued to have a nonprofit be their power of attorney, a nonprofit to be the guardian, because they didn't trust their siblings to make decisions for their mom or dad. It's very emotional. When I say relational, is that because our families, brothers, sisters, cousins, aunties, uncles get involved. It's a tough physical job. You have to transfer people back and forth from the car to the bathroom to the TV room. It's just very, very costly emotionally. And, I have a relative that I said, you've been caring for mom for 15 years. And they said, no, it's been 20 years. I said, wow. And it's already ruined their lives. Personally, 2 of them have gotten divorced already in dealing with that. I just saw a show the other night. Oh, there's a great show called Aloha with Love. It was made here in Hawaii, and how the brother was taking care of the sister, and the sister died, and so they deal with what do we do for the legacy of the house and everything like that. So get a chance. This I bounce all over the place. But Aloha with Love is made locally here in Hawaii. Obviously, the first line of defense for caregiving is family. That can be very difficult. I've seen families, yes, grandchildren dealing with caregiving. I don't ever recommend having grandchildren because they have their own lives. They have to make their own, go to college. They have to make their own career. They can do it part-time, but not full-time. I've seen some families, oh, my granddaughter will take care of me. It's very difficult. I think I mentioned last webinar that I know 2 people, one the client, one's a family friend, that at 50, they retired to take care of their parent. I'm sorry, at 40, one at 40, one at 35. The one at 35 has no Social Security because he has to have 10 years of working to get Social Security. And that's very sad. So his parents finally passed away. At 67, he's going back to work to get the 10 years of income to get for Social Security. Very sad. Great option is adult daycares. To me, that's the best bet after you use up the family resources, because adult daycare is a great way to drop off mom in the morning if you're working, come back, pick her up. They run between $65 and $80 a day. If you have long-term care insurance, that'll cover that. That's as long as they qualify. There are adult day centers that take Medicaid, by the way. But every adult day center has different qualifications in terms of who they take and who they don't take. Obviously, if you can pay for assisted living or ARCH or CCRC, Continuum of Care Retirement Community, that's great. We'll cover financing a little bit later on. So a lot of times, I've seen several cases where they say, well, I'll never put mom or dad in a care home. That's a great goal, but it's very difficult over time Um, and it can be very costly. Hawaii's real estate is very expensive. So obviously, all these care homes are in properties in Hawaii. And it's very expensive to run these properties, very expensive to acquire the property unless somebody donates the property to you. Um, and of course, cost of living, cost of care, cost of employees, insurance, all this adds up. I've done 4 sessions with a local attorney association, and even they were surprised how costly it is. I believe Hawaii is, I think, the 4th, 5th, or 6th highest cost of care in the country. Not the highest, believe it or not, but it's very costly. So yes, not everybody buys a Mercedes Benz, not everybody buys a Toyota. So you have to think about it yourself, how important is quality of care to you and your family and to your loved one. Even for yourself, I'm 62 now, so I bought long-term care insurance. We'll cover that a little bit later on, but it was really important to me because I only have one son, unfortunately, because most of the time the care is done by a female, and I didn't want him to be taking care of us, so we have long-term care insurance. And little tidbit: no long-term care insurance policy is going to pay all the cost of care. So we're going about line of credit. We're going about the reverse mortgage line of credit. We're going a little bit down the road in Medicaid and some legal things to think about. I always recommend bringing in a third-party professional that specializes in this. I have the designation certified senior advisor. There's only about 3 or 4 in Hawaii. It's the only certification that's double accredited. There are 40,000 accreditations in the country, and only 10% are accredited. In other words, a third party reviewed the curriculum and the test and certified it's a good designation. A lot of times I've been to classes where they say, okay, this is gonna be on a test, write this question down. Designations that are accredited, they don't do that. But certified senior advisor is an overall certification that covers 22 different areas of aging. It's a 3-day course with a $300 question test, and they have CE every year. And it's really important to understand that. Also ethics training. This one right here, certified long-term care, is a certification in long-term care planning. That's another tough, difficult course. It's not accredited, but it's a very good course to get an overview of the cost of care, financing long-term care, the different levels of care. And if you can visit some facilities, that'd be great. If you're in the planning stages right now, it's important to visit facilities, ask questions. And so many times people will just call them up. That works, but you can't get all your questions answered. You can't get a good feel of a property by just over the phone. Take the time, take off work, and go visit properties, try the food, talk to who the care manager is, social worker there, staff numbers, day and night and midnight, what happens in emergencies, things like that. Very, very important to do your due diligence, but also to really talk to the people. These are the people that are going to take care of your loved one or yourself. So it's really important to take it to heart and be serious about this. And I mentioned this last time, most people spend more time planning a vacation to Vegas than they do about the long-term care planning. And it's really crucial. You talk about people's lives there. This is about today's dilemma about long-term care. We've been calling this a silent tsunami for 15 plus years. And it's amazing how we're still calling it that. It's here. As you know, through the media and talking to different people, we are a lack of over, I forget it was 1,000 nurses that are going to retire and certified nurses aid is even worse. Are growing vacancies of Medicaid long-term care beds. There are beds today, but down the road, I think we're going to have a shortage of long-term care beds for Medicaid and for private pay because it's too costly to build properties. It's too costly to build a structure. So hopefully, I'm thinking hopefully the state or city will convert properties that are underutilized into care facilities. The bottom line, what's your plan? It is so critical to start the planning process. And I get this all the time. Well, I'm pretty good now, so I'm not worried about now. I'm worried about 5, 10, 20 years from now. We're not gonna be able to drive. Your kids are on the mainland. So what I created really briefly, this is my parents, by the way. They're both in scooters. Unfortunately, my mom passed away last month, and it was pretty quick. We were going to call Navian, but it was just pretty quick. She lived a great life. It's a time of life that we all have to worry about. So anyway, I counsel families every week. This is a script that of questions that I put together over the years. It's not deemed to be the all answer questions to your long-term care planning needs. It's just a basic starter that I work with people and families. I try to get involved, get the whole family involved if they want to, but it's just a real quick conversational kind of question, kind of a thing. How we determine how to pay for long-term care. So a lot of your questions were brought up via email from Debbie when you signed up for the session. So, along the way, basically, reach out to me, Debbie, or put in a chat box about questions. But when it comes to financing long-term care, I mean, obviously Medicaid's, we have a really good Medicaid program in the state of Hawaii. It's just, I don't want to say jumping into hoops or jumping out of hoops or jumping over hoops. And every state has qualifications. Every state has an application process. Every state has an office, Department of Human Services, that will walk you through that. There are private companies that will help you fill out the application. It is quite time consuming. So Debbie, we have the Word document here shown here. Did I pull that one up? Oh, let's see here. Okay, there you go. You see that there? Okay. So basically, when we do planning, I try to quiz the family and question the family and the senior about what's important to them. If they want to stay at home for the rest of their life, are they able to stay at home for the rest of their life? Is it livable? Is it safe enough? Is it one level? I knew a family just recently, they bought a home 5 years ago with many stairs, and they were like 75 already. Now they're 80, 81, having a hard time climbing up those stairs. And they didn't think about that down the road. Now they're going to sell it and they have an option, move into a condo or move into a retirement facility that has continuum care. So it's really hard for families to plan. Let's just say you're 70 years old now. It's hard to think about when you're gonna be 80, 85, 90. You have to think that way because it's gonna happen. And do you want to do a Band-Aid decision process or a long-term care plan process? It's so crucial to families to think that way. Because as people, a lot of questions that came up to Debbie, the cost of care is Hawaii. It's all over the place. So, and I have a sheet, by the way, I'm going to show you a little bit later on. Genworth Financial basically created let's see, where did it go here? Oh, created a website. Where did it go? Your website. Here to go. Created a website that has cost of care, and it's really important to understand that. We'll bring it up a little bit later on. So let's just get back to that screen. So a lot of times it depends if, when I go, this is the question process I go through, and whether this affects you or your family or not, is important to think about it. Whether you own a home or not, or if you're renting. Renting is a big issue now. I just talked to people over at Catholic Charities the other day. They have a new property coming up on Maui, Mililani, Kalihi, yes, in town, Kalihi, they're looking at one over time. But you want to get on a waiting list, it could be anywhere from 3 to 5 years on waiting list. So if you're renting, if you own a home or condo, hopefully you made a great job of paying off the mortgage when you retired. And that's really a goal I tell everybody to do, including myself. Um, that way you have equity that you can tap into. Because as we go back to the same thing, long-term care is very expensive. Are you living on Social Security only? I believe it's 65% of people in Hawaii, retirees, live on Social Security only. So I believe the average Social Security per month is about $1,300 a month. Not easy to live on that a month, you know. You have some kind of retirement income for the rest of your life. So when we're looking at financing long-term care, these are the questions I ask because it's very costly. Can you imagine paying $5,000 or $10,000 a month for long-term care? It's very costly. So you have a mortgage payment still. If not, great. If you still do, there's ways to get rid of that monthly payout because you're gonna have to depend on how big the mortgage is. You might have the mortgage payment for the rest of your life. And like I said, with regard to home equity lines, can you afford or want to make a mortgage payment? That's really comes into as we retire. And I'm not a financial advisor, insurance agent. I don't do anything else to get paid but the reverse mortgage. But it's important to work with professionals because it's very costly. And as I say, when you retire, it all comes down to what comes in every month in terms of retirement income or Social Security, and what goes out every month, your expenses, your mortgage payment, your electric, phone bill, insurance, long-term care insurance, if you're still paying for life insurance, things like that. So it's really important to understand when you retire and when that plan comes involved, do a cash flow analysis of what your specific situation is. Then we go into how is your health. If you haven't had a major health issue in the last 5 years, the chance of you living to 90 is like 70% for women and 65% for men. 90 now. So if you're 70 years old, haven't had any major health issues, that just put yourself at 90, what life's going to be like. It's really hard to do. I'm trying to do it myself. I mean, I think I'm still 42, not 62. So it's important for us to think that way and do that plan, what's going to happen over time. For couples, at some point, one of you are going to pass away. So for the remaining spouse, how would her lifestyle be? What would her retirement income going to be? Because if to pay for long-term care comes down to what your monthly income is. Your tax situation is very important. Roth IRAs are pre-tax, where you pick out and pay that in the tax then versus when you take it out, when you draw the money out, it's not taxable. Versus typical IRAs, you invest the money in IRA. When you pull the money out, it's taxable. So talk to a accountant, CPA, financial advisor about that. Our asset is, the biggest asset is typically the home. And depending on your savings and your retirement planning and your investments, it could be, your 401k, stocks, bonds, things like that. But you have to really look at that. When we're talking about long-term care, average stay at a long-term care facility is about 3 to 4 years. So it really depends on your health. Depends on whether you have dementia, Parkinson's, cancer, any debilitating kind of a disease. I just spoke to Coach Les Murakami, the baseball coach. We did a cover story on him several years ago. He's had care, I believe, for 16, 17 years. And it's public knowledge that he bought lifetime care. I mentioned this before. And his wife, I asked the wife, because the wife basically told him to go buy lifetime care. And she said, the coach's parents needed care and was more than 5, 6, 7 years. I think it was 10 years, I believe. They're caring for his parents. And so the wife said that's the reason why they bought lifetime care. It's so expensive that they don't even sell it anymore. You wouldn't want to even buy it anymore. They stopped that about 6, 7 years ago. So right now, I believe the most you can buy is 5 years of long-term care insurance, but we'll get to that a little bit. So know your assets, because over time, if you want to continue to live that lifestyle of travel, donating money, helping the grandkids, paying for your new car, you want to put solar, you need to renovate the home, that's really important but that's going to affect how much assets you're going to have left over down the road to pay for long-term care. So it's something that really is take a serious, hard look at. Use a professional that understands this area and make sure they're fiduciary. Fiduciary basically means the only important decision is for you, the care, not for the financial advisor, not for the attorney, not for the CPA, not for the insurance agent, not for the mortgage guy. Finding the best product or service program for you without regard to anybody's income on the back end. We see this quite often. People out there working just make the money, and without a process to explain all the options to a senior or their family or even the children. So they can, a lot of time we're seeing today going forward, a lot of children are helping their parents navigate or plan their long-term care needs. And it comes down to, are you living here? Are you living there on the mainland? Are you female, male? Do you have kids? Are you single? Are you living with dad? Do you live close by to dad or mom? If they move into a facility, are they close to where they live or you live? Because if I live in town, I'm not going to drive. I drive to Kapolei every day, or Kaneohe every day, maybe a couple of times a week. So it's a conversation to have with the family as early as possible, and plant seeds, as I call it, as much as possible to really start that planning process. When I meet with families, we never make a decision in probably the first 2 sessions. We want to always do some digging and investigating and taking out people's opinions about the quality of care, the cost of care, whether you can afford it or not. And it's just something that it's a balancing act. It's just something I think is just very difficult to navigate. Where do we go here? So I want to talk about this one screen here, the long-term care ombudsman. Basically, it's a state office. There are people that you can call for complaints about facilities, care. Their website also has a list of properties. It's not very detailed. They can't recommend anybody. They won't tell you a lot about the properties. They can tell you whether there's been a complaint or not. They're supposed to be public. They are supposed to be updated, but obviously, like anything else, may not be the most current. So when you do your investigation of calls, you want to make sure that you're getting the right answers, because you don't want to make a decision based off old answers or complaints, or they didn't put the complaint in right away when you decide on a facility. Facility, when it comes to facilities, it could be, let's see here, let me go to this one here. Let's go. So I'm not too sure if anybody's heard of this one here, Kupuna Care Pair. It's a property website created by Mr. Todd Pang. His family owns 2 care homes, and they're building a larger property off of Nuuanu. But he created this website because he found that the biggest issue with Hawaii with regard to care is, where do we put them? What kind of places are there? So this is a website, you sign up for it here, and they're taking the different properties around town. And they have a menu of a marketplace that will tell you the cost per day, per room, per month rather, the locations. He has adult daycares, independent living, assisted living, care homes, foster care homes, and nursing facilities. So you want to kind of whittle down to your investment or your budget. Find out how old they are or new they are, license capacity, availability of beds. This, I believe, is probably current within a month or 2. They do charge a small fee once you use their services. It's very affordable, but this is probably the most up to date website you're going to find in the state. Um, it services short term respite, long term care, long term, uh, and all these other issues. One of the biggest things I found, especially with rehab, is a lot of rehab places are shared rooms. They don't have any private rooms, so it's kind of important to understand that. Um, and it's something to interview the PT or OT. What kind of partners do they have? And it's really important to ask a lot of questions. Work with your doctor. A lot of times, your doctor will recommend a PT or a rehab place that they know, which is fine. But you also want to do your own research themselves. Um, Obviously, a lot of them are Filipino. They do a great job. Obviously, in any industry, you're going to have a small, select amount of property that are complaining, have complaints. Um, he has state facilities here, neighboring facilities here. It's not all of them because he's been working on this for over a year, but it's really important. And this is the first step to do your own research. Your doctor can give you a list of rehab places. The state website has places too. Like I said, I don't believe anybody's website is current as Kapuna Care Pair. But it's just something that I think is good. Oh, here's the map. That's what I was looking for. I couldn't find it, guys. Let's see if it works. There you go. Plaza Pro City. My own father is in a plaza in Kaneohe, by the way. License, da da da. I think you got to go dig deeper for the pricing. This is Holy Family. It's a type 2 property. Capacity, wheelchair accessible. That's a good one. See that special diets. Us in Kaneohe. Oh, wow. Ahoy Mono Road. That's down my parents' house. That's just past Valley of Temples. Let's see Eva Beach side. Independent living offers meals? No. Oh, it's independent. So independent means you're living on your own. This is a small place to see how big the place is. Oh, it doesn't say. You got to go to. They didn't give very much information to the Kapuna Care Pair, so you got to go to there. So Eva Beach is pretty popular. Let's see about this one. Oh, it's Kapolei. Oh, Ilima Lejano. Very nice facility, assisted living place. You can use that as a retirement place. They also have care. But took them, I think, 7, 8 years. They're 100% full. I just talked to I just saw him, by the way, at a Alzheimer's meeting last week, I believe it was. Mark's this administrator there, and there's a waiting list for Ilima and Lejano. They will probably run you between 4,500 and 5,500, depending. I like this place because it's, even though it's out in Kapolei, if you live on the west side, the rooms are much bigger than your normal facilities because, of course, cost of land is cheaper out that side, and so they can do that. Right now, it looks like they only have a Wahoo. Let's see here. Oh no, they got Koloa. Oh wow, Koloa. Wow. Even the name of the facility. Wheelchair, no. See, no wheelchair. Special diets, yes. Let's see, north side or towns. No, town side. Let's see, Anahola. Oh, Kapa'a side. Haumea Home Health Agency. So this is about the most information they've been giving lately. So you gotta call them to do your research. So it looks like that's all they have. Oahu and Kauai. but it's I have it saved on my my browser. Uh, oh, Molokai, wow, pretty cool. Napu'u Vai is a great little facility. Uh, Basically the biggest one there, 49 beds. Let's see what the other one is. Oh, Halima'olu. Okay, so now we know. But I would recommend you start here, uh, the ombudsman program. Um, David, when I go back and forth, is it showing that? There you go.
I can see it.
Yeah, so this is a really good place I start with all the time. You can email them questions, and they're very helpful. You got to do your own research. You got to be your own advocate. You can donate money, by the way. They just brought on another advocate there, John McDermott. He has been there, gosh, at least 15, 18 years, if not longer. But he's going to be there for a while. So it's really important when you're looking at it, know your rights, share concerns, make complaints. It's really important to understand that. So do your research. And if you need more information, I can forward you more information depending on what you're looking for. Okay. So like I said, when it comes down to financing long-term care, it's really important to understand it is costly. And I was talking to somebody just the other day, it was yesterday, and you're saying, how come it's so expensive? I said, well, real estate is expensive here. Everything's more expensive here. Then he talking about his house, what his parents should do with his parents' house. Should I sell it before to pay for long-term care, or should we go on Medicaid, or should the children help out? You know, a lot of times families, everybody would drop $1,000 a month. You know, it depends how many people you have in your family, and pay for dad's care or mom's care, because they don't have income to qualify. And in fact, I was telling, he's my age, so he's 63. So you better buy long-term care insurance yourself, because down the road, will your kids be able to afford it? So I'm 62. I said, listen, let's just say at 85 years old, we're gonna need some form of care. If it's 10,000 a month, let's say it's 5,000 a month today, what do you think it's gonna be 25 years from now? It's gonna be very expensive. It's gonna be over 10,000 a month. That's for independent living. You know, skilled care probably bring you over 20, 25,000 a month. So that's how far down the road you need to think about things. Obviously your legacy, but your tax situation is important to think about. And I always tell people, have a backup plan for your retirement savings, your 401k, your IRAs, your stocks and bonds. Work with a financial advisor that understands these issues of long-term care planning. So when I work with a lot of financial advisors, I was on the NAIFA, National Association of Insurance and Financial Advisors here in Hawaii. I'm no longer on it, but I hang out with a lot of insurance agents, make sure they understand long-term care, make sure that they have options, different policies, because 10 years ago, there were 100 providers. Today is about 11. I think by next 2 years, it might be down to like 6 or 7 providers, insurance companies still in the marketplace. That's how volatile this industry is. That's how expensive it is. And you know, if you have a policy right now, somebody will take it over. We have not seen anybody go bankrupt yet, but it's something to think about down the road. You have to be your own advocate. We tried to lobby the state in 2010 and 2012 to create some kind of a state long-term care insurance plan. There are a few states that have it around the country, I think 3 or 4, where you buy a policy that state approves, and once you use that insurance policy up, if you need more long-term care past 3 or 4 or 5 years, then you could qualify for Medicaid. But it's a way to do that. That was shot down many years ago. I believe they're looking at trying to bring that program back, but takes a lot more research and takes an advocate to push this. One of the politicians have to push this. But it's been explored a little bit more so on the mainland because we understand long-term care is such an issue today. When we do counseling, we talk to the family, talk to the children. Do they care what their inheritance is? Are the kids on the mainland going to come back? Who's going to get the property after you passed away? Look at all the options. Today, one of the biggest options is life insurance with a long-term care rider. It's not insurance. It just allows you, let's say you bought a $300,000 life insurance policy. Obviously, you got to be healthy. And if you have 6 months or less to live, that insurance company knows they're going to pay out the policy. So it allows you to take out a percentage of that income, that money from the life insurance policy to pay for long-term care. So let's say it allows you to take out $10,000 a month. That's 30 months for a $300,000 policy. It allows you to, every policy is different, by the way. So you got to ask your insurance agent. Some may $5,000 a month. But you got to ask them, how does it pay out and how do they qualify to pay out? One surprise that we found out, gosh, 10 years ago was a second to die life insurance option. If you want to give your kids anything, life insurance is the only guarantee. As long as you make the premium, they're going to pay it out. So second to die life insurance policy is a policy where it covers both spouses. As long as one is healthy, they can qualify because they know if the first one passed away, the unhealthy spouse, they're okay. Doesn't pay out until the second person passed away. That's what they call a second to die life insurance policy. Not a whole lot of people use it, but I've been recommending that for over 10 years now for people that are under 75 and at least one is healthy. So the premium may be less than a mortgage payment. It preserves some equity if you take out a mortgage or a reverse mortgage. We use it to pay down the reverse mortgage down the road because it's important to understand how that works. Would a home equity line of credit or a reverse mortgage line of credit work? So basically, like in my own parents' family, we looked at how to pay for long-term care, and home equity depends if they have enough income to qualify. Was probably going to be a better bet to be able to take out funds little by little to pay for care. And as long as you have enough income to pay the back interest per month, that works. For those of you that may not have enough income to pay back a mortgage payment, the reverse mortgage is becoming very popular today. It's basically just like the line of credits of the banks and credit unions. The difference is you're not required to make monthly mortgage payments because obviously you may have less income, or if one spouse passed away, they're not going to have enough income to make a mortgage payment anyway. So today, with people's values gone up in the last 5 years, they're taking advantage of the equity that's built up and setting that line of credit aside, not tapping until they need it. And that's really critical. When it comes to long-term care planning, have the funds 5, 10, 15 years down the road that they may need for long-term care. And a unique benefit of the reverse mortgage is that the line of credit actually grows every year. Some banks will limit you to $200,000 depending on what you qualify for. And if you don't use it, they may take it away. And if you're a couple and you have home equity line of credit from a bank or credit union, and one spouse pass away, will that healthy remaining spouse be able to pay that home equity line of credit interest every month? So that's when they look at the reverse mortgage, because you have the option to pay anything you want per month or nothing at all. And taking advantage of your home equity is built up. The line of credit grows over time, every month, every year, guaranteed to them. And the line of credit can never be taken away. So it's there. I counsel families, set it up, don't touch it, because only time the interest grows on that is if you take out money from the line of credit. So we only charge you interest when you take the money out. The difference is you're not making mortgage payments every month. So over time, the interest that you don't pay every month is added to the balance. So that's in a nutshell how basically it works. You remain on title, your name or your trust, revocable trust, by the way. If you have Alzheimer's dementia, your power of attorney, and your successor trustee kicks in. I did leave out Medicaid. Medicaid for a lot of people it can be a little complicated. They can talk to the Medicaid office here. You can go online. There's an application online. There are a few companies that do this. Cardin Outreach, they do health insurance for Medicaid and long-term care for Medicaid. Or Scott Gardner and Company. They are been business for a while. They do both, same thing. They both charge a fee. So you can inquire about what that fee is, and if you can afford it, I recommend you do that because the qualification process can be very time-consuming and very detailed. Obviously, there's standard qualifications of 5-year look back if you took money out, if you transferred money, if you sold the property. There's the net equity qualification, and I believe it's like 900 plus net equity. So if you have $1 million home and you have no mortgage, let's just say it's 970, that means you have 30,000 in equity left over, you don't qualify for Medicaid. So you can take out a mortgage of 100,000. And so from $1 million property, now you have a net equity of 900,000. You would qualify. Net equity means your value minus whatever mortgage is on the property. That's how they do it. Unfortunately, Medicaid, I tell people when you go on Medicaid for long-term care, he who pays for the care controls the care. So you relinquish a lot of the control of your loved one's care, where to place them. If there's a shortage of beds, where they go, wherever the bed is. You may not be sharing a room. You'll be sharing a room with somebody that you don't know. And they take all your income except for $50 a month. You can have one funeral plot, one ring, one car. That's it. If you have anything more than that, you do not qualify. So just something to think about. Your financial assets, they transfer typically to the healthy spouse. There may be a look back and a monthly income qualifications. So it's very difficult to understand all this. So I recommend you contact one of these people out there. Debbie, are there any questions that we want to address right now?
Let's see if anybody has any questions, please type them into the Q&A box below. We have just about 10 minutes to answer.
Yeah, so there are some questions earlier that Debbie received. Let me see. The number of people, the phone number for people using Medicaid for long-term care. I would tell you can call them, just Google Hawaii Medicaid for long-term care. You'll find the office there. I believe the application is on the website. Cost of nursing homes, care care at home. Care at home runs you between $25 and $30 an hour. A lot of time, minimum 3 hours. Vivia just started. They do, I think, minimum 2 hours, which is very good. And you don't have to have a contract or anything. What I like about Vivia is that, let's say you live in Kaneohe, they will have CNAs that only work in Kaneohe. So that was a smart thing that they did. A lot of home care companies are in our magazine. Just understand that there's a shortage of CNAs, certified nurses aides. In fact, you do not have to be a CNA to work in a home care company. All they do is make sure that you have a TB test and you do a background check. But you don't have to be a certified nurses aide. You do want to make sure they have CPR trained. They have understanding of memory care if they have dementia issues, and transferring, how to transfer in and out of bed, bathrooms, tables, things like that. How to best avoid family legal battles. First step, talk to them right away. Yes, you can record it. You can file a lawsuit. I recommend bringing in a third party. Todd's mother, actually, Annette Pang, is a private consultant. She's in the magazine, and she's very good. She does mostly family communication, because that's really the key. When I counsel families, it's really important to set aside all your personal issues. The focus is got to be the care of your loved one. So I try as a third party. I don't know them. I don't get paid to do this. We just walk them through what the quality of care can look like, and they decide on what they can afford, who can take time out. I tell people fair does not mean equal. In other words, if Debbie takes care of mom 2 days a week and I take care of mom 1 day a week, and Debbie's sister takes care of mom 4 days a week, that's what working. Then Debbie will say, oh, Percy, you only do 1 day a week. I said, that's all I can afford right now. Is that fair? It's family decide. Difference between time-based and amount of long-term care. Sometimes they use their lap time. You know, that's a big story. I would, if you're looking at home care, I would, give me a call or email me, or go through the magazine. That's a big question to ask because, most families go by the minimum amount they can afford. And I get it, I understand that. But at the end of the day, for myself and my people I refer to, it all comes down to what quality of care do you want? What level of care can you afford? So there's a difference between what you can afford, what you want. It's two different things. And Debbie may think, oh, just put dad in a care home, go on Medicaid. And then my brother Les will say, no, he should be staying at home. Well, how are we going to pay for that? Well, that's the next step. So communicating with each other is hard to understand. Long-term care is not paid by Medicare. Medicare is health insurance. Medicaid is a state plan. Once you qualify, they do some home visits a week. I just found out through different hospital facilities. It is limited care. It's not full-time care. If you're in the military, they have a program called Aid in Attendance that can pay up to, depending on your rank of your when you retired or however service you time, you get paid out a certain amount per month to pay for care. It's very complicated application process, so you can contact the VA. Let's see what other questions you had. Long-term care insurance, I bought mine at 58. I'm 62 now. I bought it at 59. Had it for 3 years. I have a shared plan with my wife. It's minimal. So it really depends on what bells and whistles you want. Elimination period means when would a policy kick in? So we put 6 months because we can pay for private care for 6 months. And after that, the policy kicks in. So a lot of people do only 3 months. So your premium is based on these bells and whistles. My premium per year is, I believe, is $2,200 a year. Women today are more expensive. They changed that about 5-6 years ago because they know women will live longer. So theirs is more expensive. I believe my wife's policy is maybe $2,500 a month. I'm sorry, $2,200 a year or $2,500 a year. That was 59. I may be overweight, but my blood pressure, I don't take any medication. I'm pretty good. So I got a very good rating. If you're dealing with an attorney, make sure that attorney works with your financial advisor or is able to at least counsel you on long-term care. A lot of times the financial advisors or the estate planning attorneys do not do that. So because they're too busy doing trusts and wills and power of attorneys. Option if you can't afford care home or nursing home. When it comes to reverse mortgage, you can refinance a reverse mortgage, by the way. So give me a call on that. And if you don't want to sell the house, I have a friend right now. They don't want to sell, but that's the only option they have. So they're going to go broke themselves, her and her brother and her sister, pay for mom's care and versus selling the house. You always want to plan it and don't wait till the last minute. Don't wait till this is the only option you have. Make decisions while you have options, So anything else, Debbie? No questions? No chat box?
No, nothing. I think we
Wow.
answered a lot today. I mean, those are really good resources. I like the websites that you showed. So I'm sure it answers a lot of questions about the cost of care homes and all that. So that was great. I guess if there's nothing else, we can go ahead and end the webinar.
Yeah, so guys, just you can always give me a call. My numbers are down there. This is a long-term care ombudsman. Kapuna Care Pair. Just Google that. Kapuna Care Pair, PAIR. Just Google that. That's what I did. My contact information is here. And I don't charge for consultation at this time, at least for at least another year. I am busy, so You know, it's very difficult fitting my schedule, but I will work with you as much as possible. Over the phone is what I do most of the time, you know. And also utilize our website. Our website has a lot of information. All our past radio shows there, the webinars that we've done are all there, and all the past issues are there on our website as well. So, Debbie, thank you so much.
No, thank you. I
And thank you
appreciate
guys
it.
for attending. But anyway, have a great time. Make sure you plant the seeds and be proactive and be your parents' advocate for their care. Okay?
Thank you.
Thanks, Debbie. Appreciate it. Aloha. Live
Bye.
well. Bye-bye.